Do you have dizziness while sleeping and getting up out of bed? Do you know what that could possibly be? I hear that all the time from patients who seek my help for dizziness or vertigo, so we're going to talk about that important question in this video. But first, I am Kim Bell, the Vertigo Detective, and I want to make sure you know about my new book. It's available now on Amazon called Navigating the Healthcare System as a Dizzy Patient. And I actually wrote that book for you. I wrote it for everyone who cannot work with me in person for whatever reason. And it's to help you skillfully access healthcare to get relief from dizziness and vertigo. Now let's get into the topic for today. Many patients complain of dizziness while they're sleeping. Sometimes patients even experience spinning in their dream, and then they wake up spinning in their bed, and it's terrifying, and they don't know what it could be. Some patients get an episode of dizziness or vertigo while they're lying on their back. Some patients feel it when they roll over to one side. Maybe they roll to the right and they feel a spin, or they roll to the left and they feel a spin. They can just feel a wave of dizziness. Maybe they feel a wave of nausea. And in most cases, it's going to resolve within a minute. But maybe their heart starts pounding, they get sweaty, they get clammy, they have a full fight or flight reaction to that. And so that can make the symptoms last a little bit longer. Some patients notice that when they've gotten out of bed in the morning to make their first trip to the bathroom, that's when they feel the dizziness hit them, or they have a spinning episode. And so those are the cases that I'm speaking to in this video, but I want to be clear that this channel exists to offer hope, information, and education. This is not individual medical advice. So when I hear people say that they got dizzy lying in their bed, rolling over in their bed, or getting out of bed, so dizziness while they're sleeping, dizziness when they get up, the very first thing I'm thinking is BPPV. That's benign paroxysmal positional vertigo. These are the so-called ear crystals that can come loose anytime. Most of the time, these ear crystals come loose in the ear. They become dislodged and displaced from where they belong spontaneously with no known cause. And it's the most common in people in their 50s and 60s, with 7 women for every 1 man who gets this condition in that age group. I think it's like the hidden aspect of perimenopause that women are not warned about. And it can also occur for other reasons, like younger people who get a concussion, they bonk their head, can cause the crystals to come loose. Anyone of any age that has an active virus in their body can cause the crystals to shed. Dehydration is a known risk factor. Stress is a known risk factor. There are certain health conditions that are associated with a higher risk of these crystals, like high blood pressure, high cholesterol, osteoporosis, osteopenia, diabetes, migraines, history of trauma, car accidents, waxing and waning viral activity in your body, long haul COVID. These are all examples. Chronic inflammation is another one. These are all examples of health conditions that could predispose you to getting BPPV. Those are the ear crystals. But most of the time, it happens spontaneously with no known cause. So if you are experiencing dizziness while sleeping and getting up, I want you to think BPPV and try to check out some of my other videos on that topic.